Physician from Fort Worth, Texas, who was in Liberia when he contracted the disease, came to the United States. He was wearing a protective suit, and he actually walked from the ambulance to the hospital when he arrived at Emory University Hospital in Atlanta. So far, 729 people have died, and over 1,300 have been infected in what is now the largest outbreak of Ebola in history. The outbreak is centered in the West African nations of Liberia, Sierra Leone, and Guinea, and U.S. officials have urged Americans not to travel to the region. A second American health worker infected with Ebola, Nancy Wrightbull, is also expected to return to the U.S. for treatment in the next few days.
There is no place in the world that is more prepared and dedicated to finding cures for infectious diseases than right here in America. With 2 Americans infected with the deadly Ebola virus, it was only a matter of time before they were brought to this country for treatment, as attempting to treat them in varying conditions overseas might have been a death sentence. The words global pandemic are used at times such as these, and Americans deserve to know how much danger they and their families are really in. Let us welcome into MidPoint Chair of the Columbia University Institutional Biosafety Committee and Professor in the Department of Epidemiology at Columbia, Dr. Stephen Morse joins us today. Dr. Morse, thank you for being here.
Thank you. Glad to be with you.
Doctor, I'd like to start out first of all with something that has only happened recently in an interview piece of sound that you will hear as well. This comes out of the nation of Nigeria, where they confirmed their second case of Ebola. This, again, was also a doctor who treated an infected man in Lagos, testing positive for the virus. Here's the clip.
As at today, we have the first of those health personnel who have now become Ebola positive and is being treated as such. So if we are keeping records, this is now the second case of Ebola virus disease in Nigeria.
Doctor, here we have two American doctors. We have another doctor here. We have what is already a tragic amount of people who have died from Ebola. I hate to use those words, but there are already people using it. The possibility of global pandemic. Are we looking at something like that, or is that just sheer scare tactic at this point?
I think it's extremely unlikely, simply because Ebola does not transmit very well, and despite the number of cases we're seeing, it's actually very hard to catch. The people who have become infected with Ebola are basically people who are in close contact with the patients, caregivers in the family, others who may have some direct connection, for example, helping to prepare the bodies for burial. Sad as that is, and healthcare workers. So these are the people right in the line of fire. They're coming in contact with infected bodily fluids or infected tissues from the patient without having adequate protection, such as gloves, masks, and so on, to prevent them from having this splashed onto them or touching these infected materials. That's really what it takes, because Ebola does not spread through the air like flu or SARS. So it really does require close contact with infected materials from the patient.
Let me make sure that we get this right here, because over the weekend I heard not one but 2 different doctors talk about contact is the only thing they said. If you have contact with a person who has Ebola, yet I have in front of me spread only through intimate contact with bodily secretions such as vomit, blood, or feces. Yeah. So if we're going to make this correct, we've got to make sure that those who are out there telling people make the point that it has to come from fluid contact and bodily secretions, not just making initial contact with another human.
Yes, casual contact, being a few feet away, walking past an Ebola patient, is probably not going to give anyone Ebola. You really do have to essentially touch it or have it splashed into your eye, something like that. Now, this can happen with inanimate surfaces if there's blood from an Ebola patient for a few hours, but it's a very low risk. and most people who are even walking next to an Ebola patient a few feet away don't have anything to be concerned about in catching it.
If you don't mind, let me make sure that I make this point again, because it's funny. You touched on a second issue that came up over the weekend in discussions with friends here. One asked about the fact that if there was bodily secretion fluid that was on a chair or on an airplane seat, for instance, or someplace that you come in contact with, you can catch it that way, but are we saying only if it's within a certain period of time while the virus would still be live?
Yes, I mean, what happens is these blood, for example, would dry, and then you're not very likely, even if you could still find virus in there, you're not going to be able to get it onto your own skin and get the virus, get infected with the virus. On an airplane seat, hopefully you're clothed, no danger there really. Obviously we will be learning something from the Nigerian experience where a patient got sick on the plane, but the people in greatest danger there were the crew members and others who had to help that patient and come in close contact. As far as I know, no one has yet gotten sick from any of the other passengers on the plane or crew members, but they're obviously continuing to watch anyone they can find. And I think that'll help us to understand if that's possible. I think it's very, very unlikely.
All right, now how scared should people in America be now that Ebola is really in their own backyard here for the first time?
Well, I don't think there's any real cause for concern. It's only going to be an issue if an Ebola patient walks into an emergency room or a hospital, and if they're identified fairly quickly, diagnosed fairly quickly, put into proper isolation facilities with proper precautions, there's really very, very little risk to the general public, and no risk at all to the general public. The worst case scenario may be someone will not be immediately diagnosed, but I think it would be pretty quick in a very short time before they found this person and took the appropriate precautions. And we do have good infection control precautions, so it's just a matter of making sure that you apply them rigorously and isolate that patient to keep them away from other patients in the hospital.
Couple of minutes I have left here, and this comes down to travel, because it is a global society now. People are getting on planes every day, and they travel without knowing they have anything. You have a group in South Korea that has basically disinvited a certain group of students to be at a conference of theirs because they are coming from an area that is infected with Ebola. You have people now who are talking specifically in the United Kingdom, where they're going to have nurses on hand who will start to look and watch people and see if perhaps they have any sort of signs, outward signs, if you will, of Ebola. Are we reaching a point where, because of the deadliness of this disease and the fact that it can spread so quickly, that we need to have in some countries now greater control over airline passengers here, and perhaps even some sort of screening to make sure that this does not become that global disaster?
That's been a subject of concern, but I think that it will become a wider issue only if people with Ebola come into an area where there isn't adequate medical facilities, isn't adequate infection control. In some developing countries where they may not have the resources to do proper infection control and keep that patient isolated. In Europe, in most of North America, I think that would not be a concern.
When we look at the fact that we now have two Americans, one who is here, one who is coming to America right now with Ebola, and I hate to ask this question, but I'll be blunt about it. Are they coming here because it is the only place that they can be treated, knowing full well that Ebola can't be treated from what we know, or are they simply coming here to die?
As far as I can tell, at least the first one who came was able to walk out of the ambulance and seems to be doing quite well. We're guardedly optimistic. We don't know, but he seems to be perhaps in a few days we'll know, or in a week or so we'll know if he's out of the woods. He seems to, I think, be encouraging in that respect. We have yet to find out about the other volunteer, but they're not coming here to die, and they're getting very similar treatment, perhaps a little higher tech than they would get in Africa in the hospitals that are handling the Ebola patients, especially the ones set up by Médecins Sans Frontières, Doctors Without Borders, which are quite specialized and pretty advanced. What they are able to get here is more attention, higher tech, intensive care, not fundamentally different, but a better infrastructure so they can be monitored more often, and perhaps some experimental therapies that are not available elsewhere.
We hope for their health as well. Dr. Morse, thank you so much for being with us. I hope we talk again and we find out that things are much better. We thank you for your time.
Thank you.
Later on this hour, Newsmax DC insider John Gizzi inside the Beltway. It's all right here on MidPoint.